Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for British Columbia for Monday, August the 31st. We're honored to be here on the territory of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nations. Tuesday, tomorrow, and Wednesday at 3 o'clock, Dr. Henry and I will be providing a written briefing with case counts and other relevant information with respect to COVID-19. On Thursday in Vancouver, Dr. Henry and I will be presenting or giving a briefing about COVID-19 in BC. That briefing will include some updates to some of the modeling that has been done and other presentations and information relative to the pandemic in British Columbia from Dr. Henry, so you can expect that on Thursday. And with that, it's my honor to introduce Dr. Bonnie Henry.
Thank you, and good afternoon. I'd like to start by recognizing that today is International Overdose Awareness Day, and our thoughts go out to the families and friends and communities of the many people that we have tragically lost here in British Columbia and across the country to the overdose crises that we are also dealing with here in this province. Today we are reporting as well on the COVID-19 for 3 reporting periods. From Friday to Saturday, we had 86 new cases diagnosed. From Saturday to Sunday, 107 new cases. And from Sunday to today, 101 new cases, bringing our total to 294 new people diagnosed with COVID-19, including 3 epidemiologically linked cases over the last weekend. That brings our total here in British Columbia to 5,790 people. That includes 1,900 people in the Vancouver Coastal Health Region, 3,042 people in the Fraser Health Region, 175 people in the Vancouver Island Health Region, 440 people in the Interior Health Region, and 154 people in Northern Health Region. 79 of our cases have been people who reside outside of Canada. We currently have just over 1,107 active cases in the province in all of our health authorities, of whom we have 28 people now in hospital, 10 of whom are in critical care or ICU. In the past weekend, we have had 4 new people who have died from COVID-19, 3 of whom were residents of long-term care. And our condolences go out to the families, to the friends, and to the care providers for these people. We have 2,723 people now under active public health monitoring because they have been a close contact of a case. And we're now up to 4,406 people who have recovered from COVID-19. In terms of outbreaks, we have 1 new healthcare outbreak in the Normanna long-term care home in Fraser Health, where we have a single healthcare worker identified with that. And we have 2 outbreaks that have been declared over. One is the Dania home outbreak in Fraser Health, and the other, thankfully, is the Holy Family Hospital outbreak in Vancouver Coastal Health, which was, as we know, a very challenging outbreak. And we are all very relieved that this has been brought under control. There are 10 active outbreaks in our health system, 8 in long-term care and assisted living, and 2 in acute care. And we're now up to 725 cases associated with those, 440 residents and 285 staff. We have no new community outbreaks, although we do have a community alert for the Presbyterian region that Northern Health has put out with a number of cases associated with events that have happened in the month of August. So anyone who attended events, gatherings, or ceremonies during this period is asked to monitor themselves closely for symptoms and to contact public health. We have testing available rapidly in the area for anyone should symptoms develop. On a positive note, the Kelowna area cluster that started after the long weekend in July has now been officially declared over, as we've had no new cases associated with that over the last few weeks. On Friday as well, we announced that the Haida Gwaii outbreak has also been declared over, and it really is the communities coming together and working together to manage these clusters and these outbreaks that has made a tremendous difference in making sure that we can bring them under control as quickly as possible. So as we are looking now to the fall, tomorrow is the 1st of September. We are entering a new phase of our BC COVID-19 pandemic. The increase in the number of new cases that we have seen over the past few weeks remains a concern for all of us, and we all have to do our part to ensure community spread remains low and that we are actively supporting public health teams to quickly manage these new cases so we can contain the spread and find that balance that we need. After many months of restrictions, we all needed to reconnect with our family, with friends, with our communities this summer. We traveled, we enjoyed our province, and many of us recharged. Now we must slow down on our social interactions, and we must prepare for the respiratory season ahead. We've talked many times about the fact that we will likely have a second wave. We've seen a surge in cases, but we've managed to keep our curve flat, and we need to continue to do that work as we move into our respiratory season. To be successful in this next phase, we need to step back to allow us to safely move forward in this pandemic. And I need everyone to pay attention. As the cooler weather arrives, we all have to be ready. We have seen the challenges that this virus, COVID-19, has, and now is our time to prepare. As we step into our offices, our workplaces, our schools, we need to take a step back from some of the social interactions that we have had this summer. Being ready means all of us getting back to the basics that we know takes to control this outbreak. So that means going back to our layers of protection and our personal COVID-19 safety plans for us and our families. It means washing our hands regularly, keeping our groups small, giving others the space to stay safe, particularly in uncontrolled environments, and sometimes that means wearing a mask as well. Particularly when we're around people that we don't know, and avoiding those face-to-face contacts. It means always, always, always staying home if we're ill. If you have elderly relatives that you live with, or you spend time with, or you care for, you may want to spend less time with other contacts, with other friends. If you live in a small apartment, then large parties with even 10 or 15 people is not safe for you or for your guests. We need to rethink gatherings, particularly ones that we're going to have indoors. As the weather changes and we move towards more indoors, we need to keep our visitors to a minimum. And we need to think about the restrictions that we have in place. For example, at restaurants, we're small numbers, 6, for example, or the restrictions that we have in place in our short-term rental properties with a maximum of 5 visitors. Those are the guidance that we need to use in our own personal settings right now to make sure that we can continue to do the important things we need in our communities, which means going to work, which many of us have been doing for some time, but more people will be doing in the coming weeks. Staying home when you are ill is one of the most important things all of us need to keep doing. It can be difficult to tell the difference between a cold and allergies and influenza and COVID-19, and as a result, the first step for everyone is to stay home if we're not 100% healthy. And that is a challenging thing, I know that. But the bar to stay home needs to be lower than we have ever had it before, for us and for everyone in our family. Our superheroes now are not the people who put aside our illness and go to work, but the people who protect our colleagues and our communities by staying away until we're healthy again. I ask employers, caregivers, and parents to think ahead and to prepare for the coming weeks and those days when an employee or your child is feeling unwell, and make a plan for how you will manage that. And employers, This is a time we need to continue to be flexible, to ensure that we're giving employees what they need to stay home, to work from home if need be, without recrimination or financial harm. No one knows for sure what the fall is going to bring. We may see a surge. We may see a surge in influenza. We all need to be prepared now for whatever challenge may emerge. To ensure we can continue to protect our most vulnerable, the people that we know are more likely to have severe illness with this disease, to protect our healthcare system, to make sure that we can continue to have those surgeries, that we can continue to have visits in our long-term care homes. These more challenging, colder months, we have to close those gaps that we have had here in the summer and flatten our curve again. COVID-19 requires new thinking, new routines, but following our proven layers of protection will keep us all safe. Our goals for BC are clear. We need to prevent cases through our renewed personal safety plans. We need to pay attention to how we are feeling every day so that we can detect new cases as quickly as possible. And we need to support our public health teams that have been and will continue to be there for all of us over the next few months or years, as long as it takes, to quickly contain the spread of this virus. We know that is working, and we know that's what we need to do to keep us safe. So let's start today to find our new balance. Let's start September knowing we are united in our singular focus to keep going, to keep our communities going, to keep our elders, our seniors, and our families and ourselves safe every single day. And let's also continue to do this by being kind, being calm, and being safe. Thank you.
Thank you very much, Dr. Henry. I'd like to start by acknowledging that on behalf of the Premier, on behalf of the government, I think on behalf of all people in BC, the 4 people who passed away from COVID-19 this weekend in the Fraser Health Authority, but in British Columbia, to send our condolences to family, to friends, to caregivers, to communities that are affected by this, to especially the people living in care, everyone in those care homes. We understand, I think, the grief people feel, and the fact that in these times of COVID, in these times when we can't gather in the way that we would ordinarily gather, that the challenge of grieving, the challenge of loss is even larger. And we also want to acknowledge, because it's International Overdose Awareness Day, the 421 people who passed away from overdose in the last 3 months in British Columbia, in July, in June, and in May. Their loss is with us as well, and we have to acknowledge and work with everything we have to ensure that we reduce those numbers and that we keep people safe and that we recognize that loss as well. I wanted to note that's 294 cases over the last 3 days. That's approximately 98 new test positive cases today. And what it indicates, amongst other things, is the extraordinary work being done by public health, the 13,461 tests that were conducted over these 3 days, the 1,107 active cases in BC actively being monitored by people in public health, the 2,723 contacts, close contacts, people who have tested positive who are under public health surveillance. All of that is the work of public health, the contact tracing and the helping people get well, stay well, and be safe. And I want to acknowledge everyone in the field doing that work in this weekend. I also want to acknowledge that there are 28 people hospitalized in BC, either in what we think of as acute care hospitals or in rehabilitation centers or acute care centers, such as Queen's Park, which is one of our outbreaks in New Westminster. And that's 22 people in the Fraser Health Authority, and 2 in Northern Health, 3 in Vancouver Coastal Health, and 1 person who resides outside of Canada but who is being cared for in Vancouver Coastal Health. Every Monday we provide an update on on PPE, and so we wanted to do that today. To recap the cumulative totals from March to last week's report on Monday, August 24th, the following PPE has arrived in BC. Over 6 million N95 or equivalent respirators, just over 49 million surgical or procedure masks, just over 2,400,000 pieces of eye protection, including goggles and face shields, almost 88 million pairs of gloves, and just over 7 million gowns. Many of these items I've just listed and other equipment that has recently arrived are in our testing process to make sure that all products meet or exceed safety requirements before being used in BC's healthcare system. Today I can tell you that over the past week, since my update on Monday, August 24th until yesterday, we've received the following: 131,799 N95 or equivalent respirators, 833,400 surgical or procedure masks, 198,549 pieces of eye protection, 2,308,645 pairs of gloves, and 499,010 gowns. We'll continue to source and test our PPE and are working hard to pursue any and all credible leads for safe and effective product. Finally, I'd like to say in closing that, and all of you know this, and Dr. Henry has made this point, we all have to prepare for this fall. In public health care, we're doing that by preparing our acute care hospitals for a fall that will include respiratory illness season, cold and flu season. We're preparing by adding 500 people to work in contact tracing across BC to mount a campaign and an effort against influenza across our society in terms of all of the work that we continue to do in hiring and protecting people in long-term care, especially so that in the future, this fall, we can allow more visits than are taking place now. In short, this is a period for us, and has been in the last month or so, of preparation. And it has to be for everyone. COVID-19 was always, from the beginning, all around us. You could see that yesterday, on Thursday, in the report that Dr. Henry released about cases in communities in every part of British Columbia. The past 2 months have shown us just how quickly and just how rapidly it moves into our lives, our homes, and in our communities. And the announcement today by Dr. Henry of the end of the outbreak in Kelowna is an indication of that. We went in a short period of time from 2 cases to almost 100 cases related to that in that community, in interior health, and now we are back down at a dramatically lower number, under 20 active cases. And how quickly our behavior, when we fail to use the knowledge we've gained and the skills we've been taught to stop the spread, can bring the disease to our front door, no matter where we live in BC. COVID-19, this fall, will again be knocking hard on our doors. This time it's disguised as some activity we missed, a big group of friends we've not seen in a while, something we long to do again. COVID-19 is aggressively knocking at our doors, and we must not let COVID-19 in. Dr. Henry just talked about limits of visitors in temporary rentals at 5, limits on tables in restaurants at 6. And these limits must guide us in our own homes. If you live, as I do, in an apartment of about 850 square feet in my case, then the number of people that one could have as visitors in that home safely and responsibly would be a small number indeed. So as we turn our minds to the Labor Day weekend, let's turn our attention to making our long weekend plan to stop the spread for the big things and the little things we'll do during the long weekends, in the day, the evening, and the nighttime. Let's renew our commitment to being 100% all in using the deliberate, disciplined, and dedicated actions to stop the spread. Actions that make activities enjoyable, that make them memorable, and most importantly, actions that renew us without renewing COVID-19's grip on ourselves and in our province. Aujourd'hui, nous faisons le point sur le nombre de nouveaux cas pour 3 périodes de référence de 24 heures chacune, soit celle des 28 et 29 août, celle des 29 et 30 août, et celle de 30 jusqu'au 31 août en mi-journée. Il y a eu 4 nouveaux décès liés au COVID-19 durant ces 3 périodes de référence. Nous offrons nos condoléances aux familles et aux amis des 208 personnes décédées du COVID-19 et à tous ceux qui ont perdu des êtres chers au cours de cette pandémie. À ce jour, 4 466 personnes dont le test de dépistage de COVID-19 était positif sont maintenant rétablies. Pour la première période de référence, qui s'étend jusqu'au 29 août, nous avons eu 86 nouveaux cas. Pour la deuxième période de référence, qui s'étend jusqu'au 30 août, nous avons eu 107 nouveaux cas. Au cours des dernières 24 heures, 101 nouveaux cas se sont ajoutés. Cela représente 294 nouveaux cas depuis notre dernière mise à jour vendredi pour un total de 5 790 cas en Colombie-Britannique. Parmi l'ensemble des cas confirmés de COVID-19, 28 personnes sont actuellement hospitalisées, dont 10 en soins intensifs. Les autres personnes dont le test de dépistage a été positif sont en isolement à leur domicile. Merci beaucoup. Thank you very much. We're happy to take your questions.
Thank you, Minister. As a reminder to everybody on the phone, please press star 1 to enter the queue. You are limited to 1 question and 1 follow-up only. Please also take your phones off mute. You will not be audible until your name is called. First question is from Shannon Patterson, CTV.
Oh, hi, Dr. Henry. BC teachers say the new commercial where you appeared in a classroom was false advertising. It was misleading because it only showed 6 students and they were in physically distanced desks. Do you think teachers have a legitimate argument that that commercial simply isn't reflective of what the classroom environment will actually look like in September under the current plan?
So I think we need to realize that that was not a commercial about what a classroom was going to look like. What that was me as the public health officer talking with children about children and their parents about the things that they can expect in the new school year, about some of the public health issues. And it was a conversation that I had with there were more than 6 children. We had it in a classroom because that's what the children wanted. And it was an opportunity to answer the many questions that I was getting from children. So it was an opportunity for us to speak to children about some of the things that will be new and different and help them answer their questions that they had about what would happen. So it was certainly not meant to represent. We recognize that every classroom around the province looks different. And the ad reflects that, and it reflects as well a number of different age of children because it was the conversation that I was having with children about what to expect and to try and allay some of the anxieties and challenges that children and their parents are facing about what it's going to look like when they go back to school. I also want to say that, we all had masks and we talked about when we would wear them, but each child made their own decision about when they were going to wear a mask, and some of them wore them the whole time we were together, and some of them put them on and off at times when they needed to wear them. So this again reflects what we are going to be seeing in classrooms in a few weeks.
Do you have a follow-up, Shannon?
I do. With the start of school fast approaching, will the province look at increasing restrictions in other areas to try to reduce overall community transmission in the hopes of reducing risk at schools? Like, for example, maybe greater restrictions on indoor venues where people gather, like bars and nightclubs?
Yeah, so what we have done from the very beginning is look at where we're seeing transmission, and we've adjusted the orders to try and address those issues, and we have been successful in doing that. When we look at where transmissions are happening, they're happening in many different areas in our community, and we can't always put in orders to change those. And I think we need to, as we've been talking about today, we all need to realize that going into the fall is the next phase of what we need to think about. And it means we all need to take a step back and look at our contacts again to make sure that we can support those important parts of our society, like going to work, like making sure that schools are successfully opened again, and as we say, reflect what's going on in our communities. We still have very low transmission rates in our communities, and it's not one sector or the other that we can shut down, for example. It's not an either or. We need to be able to make to balance all of it as we go forward, and it's a very challenging thing. I think none of us signed up for a pandemic, and we're learning as we go, and we will adjust as we go, and we'll continue to learn and make the changes that we need. But now we need all of us to take a step back and refocus. We've been in that messy middle for the last few months, and we've been able to do a lot of things that we hadn't been able to do for quite a few months. And that's because we all worked together and got the rates quite low here in this province. And now we need to go back to that as we're moving into what we know is respiratory season. We know there's going to be more challenges ahead. And this is where our time to prepare for that and to get back to our basics again.
Next question is from Richard Zisman, Global News.
Dr. Henry, is there a number of daily cases that will make you concerned about the back-to-school plan?
There's numbers of daily cases make me concerned about lots of things, but I think we have to put it in perspective. And so, as I said many times, it's the cases that are arising in our community that aren't linked, and they're symbols of ongoing transmission that we aren't seeing. So there's no one specific number. It's a different circumstance in every community. And if we look around the province right now, most of the province has very, very low or no transmission. There's some communities where we know there's been clusters of cases and exposure events, and we're managing those. And we know in the Lower Mainland, for example, where the most population is, we're seeing more cases. So the back-to-school plan is all about, from the public health perspective, making sure we have those measures in place that reduce the probability of introduction of somebody who's sick with the virus, whether it's an adult, which is what we're seeing more likely, or a child, as well as making sure we can stop transmission if it is introduced into the school. So those are the things we're focusing on in public health, and those are the things we will continue to focus on as we move through in the next few weeks.
Richard, do you have a follow-up?
I do. The Ministry of Education has released a statement about the ad that you were asked about by Shannon, and part of it says the number of students in the room was limited for health and safety reasons, and the children are placed at safe distances from each other. And as you know, there's been a lot of concern from parents and the BCTF saying, well, if it's okay for an ad, why is it not okay for everyday schooling where we'll see kids closer together? What do you say to that comment specifically?
And so there's a couple of things, but and I'll let Minister Dick speak to that as well. But when we're talking about schools in a regular day-to-day basis for schools, what we're looking at is the classroom as your unit of connection. And that is a set, controlled environment. And we know it'll be the same children every day that will be in that small group with the same adults every day. The numbers of teachers and children that they'll interact with is contained and limited, and we will have distancing within those classroom settings, within those small numbers of groups of children. So it is a different scenario than bringing together a variety of children who go to many different schools, including that school, for a limited time to spend time with kids that are not in their social connection or not in their learning group. So it's a different situation entirely. But I'll let you speak.
I think it's important to recognize that this communication, this ad, is a public health ad, and its intention is to deliver a public health message about what people can expect when they return to school, what children can expect, what teenagers can expect, what parents can expect. And so the messages were very similar to messages that have been delivered in public health ads throughout our time here, that we're going to need, all of us are going to need, to wash our hands a lot, to stay home when we're sick, that you'll have to wear a mask sometimes, and that you'll be mostly with the same group of teachers and friends. So the effort here is not to engage in what is, let's face it, a robust debate about the back-to-school plan, but for the public health officer to deliver a public health message to people in the province who may not have heard us here at 3 o'clock, but would need to hear that message, because school will look different this year. We all know that. We know that there is very significant anxiety around there around back to school, as there has been amongst reopenings that have occurred since the beginning of COVID-19. And I completely respect the concerns of teachers, the concerns of parents, the concerns of students. And part of delivering a public health message, a very specific public health message here, about washing your hands, about staying home when you're sick, about the need to act differently in terms of a school environment, is an important message to deliver. It's a public health message. It's not a message intended to get involved in a public policy debate. It's a public health message. I think the provincial health officer delivered that message very well in conversation with children. What it is not is a representation. It's not central casting. It's an effort, it's a conversation, and was a conversation between the provincial health officer and children. And in that sense, I think it's useful. I think the broader debate, of which we're very respectful, will continue to occur. It is very important that fundamental public health messages be heard by everyone in the province, including parents, including children.
Next question is from Marcella Bernardo, News 1130.
Thank you both for taking my question. We have gotten to a point now where 4 more people died over the weekend. We've seen more people hospitalized because of this virus. Is this the second wave with nearly 300 cases recorded over the weekend?
Yeah, you know, what is the second wave? I think we are. Thanks to the good work of everybody in British Columbia, our first wave was quite low. So these are numbers that we are not used to seeing, and rightly so. And we don't want them to go any higher. But we are watching very carefully. The purposes of the measures that we put in place in March when we were seeing numbers go up were to make sure that we didn't overwhelm our healthcare system so that we couldn't care for anybody in society. And we managed to do that really, really well. So this is a surge. It's increased numbers that we haven't seen, but we're not seeing that flooding of hospitals. We're not seeing large numbers of people in intensive care, and we're not seeing the transmissions and the rates in the older age group that we were seeing. We're watching very carefully the age groups. So whether it's a second wave, whether it's a second bump, I was sort of using the analogy of moguls. Maybe we have a mogul right now that we're heading over, but we all need to, keep back on track and get over this one, get down again to the flat. And that's where, tomorrow is the 1st of September. Our summer is over. The messy middle is over. We need to prepare for what's coming up. And whatever it happens over the next coming weeks and months, we need to be prepared for that. And we have the tools. We know what we need to do to get there.
Do you have a follow-up, Marcella?
Yes, just regarding the PPE question, this might be something Minister Dix could talk to. You're often saying that stuff needs to be tested before it gets used. So could you give us any kind of indication as to how much of the product that is being tested is actually usable?
Yeah.
Overwhelmingly so. The reason I make that point every week is that some of our sources are new sources, and so want everyone to understand that we are not going to use any product unless it's ready to be used. But we are continuing to aggressively source PPE both within Canada in partnerships with other government, because we need to produce more PPE domestically, but also around the world because we need to prepare for the fall. And all of those things we're doing, and you see these very significant purchases of PPE, and I'm very proud of our team at the Ministry of Health, our team at the Provincial Health Services Authority, and others who've been involved in this for the work they've done. It's truly extraordinary the amount of PPE that has been purchased, but we need to continue to prepare, both to ensure that there's a significant stockpile, but also to ensure that we're ready regardless of the circumstances. You asked a question about surges or waves, whatever those circumstances are in the fall. So we are going to continue week after week to continue this effort to purchase sufficient PPE to support our healthcare workers. I just want to make a couple of points just about these issues, because we are in a particular moment. We are seeing more cases, and we've talked, and Dr. Henry will be talking about where the pandemic is at in detail on Thursday with more information for all of you. But just to put this in context, and we are immensely affected every time anybody passes away from COVID-19, immensely so, just as we are when people pass away in our other public health emergency. In the month of August, if you count, very sadly, the 4 people who passed away this weekend, 13 people passed away from COVID-19 in the month of August in BC, and this compares, for example, to 41 in Alberta and to 84 in Quebec, not counting today. These are as of yesterday, their 2 numbers, and ours is as of today. What it tells us is that we continue to make extraordinary efforts in long-term care and acute care and all our efforts to ensure that those who are most vulnerable from COVID-19 are protected, while continuing to take our efforts as a society to ensure that we're flattening the curve. And those efforts have to continue. And so this is not the same as a first wave in the sense that we have 28 people in acute care compared to, say, 149 on April the 5th, or 10 people in critical care as compared to 72 on April the 5th. This is different, but it requires us to dig in, especially as we enter into the fall, to understand that all of our success in surgery and all of our success in restoring visits and all of our hopeful success in terms of bringing and ensuring children and youth get back to school depends on all of our efforts, collective efforts together. This is not one of those things where 50% can be for and 50% can be against. We need everybody to be all in, and we continue to make that point.
Next question is from Tanya Fletcher, CBC.
Oh, hi there, Dr. Henry. You're urging people to step back, looking at your opening comments there. But I think people are wondering what that means tangibly. For example, you said, or maybe it was Minister Dix who said, you shouldn't have parties of, say, 10 to 15 people if you're in a small apartment. But aren't people's personal bubbles still only supposed to be 6 people? So do you think is there some confusion as we try to redirect our course around, how many people we're supposed to be with at the very, basis of it?
Yeah, and it is a challenging thing. Right now, we've learned that we're going to be living with this virus for a while. So how we have contacts in the community is really important. We know that we need to go to work. We know that we need to go to school. So when we have to balance those things, it depends on our own family, our own risk. But for every person that we come in contact with, every additional person, it grows up in a logarithmic fashion. So if it's just 1 and 1 that I have contact with, my chances of coming into contact with it are just 1. But if I have 2 friends, my chances then go up logarithmically. There may be 6 people that I have potential contacts with. So these are the things that we need to think about again now. We had a relative period of quiet during the summer, but we found that when we had people getting together in environments where we're close face-to-face, talking, laughing, celebrating, that those were environments where this virus passed quickly. We've seen it in funerals, we've seen it in marriages, engagements, other important ceremonies. So now's our time again to step back and look at that. We need all of us to have a personal balance. And it's not a simple answer, but we're trying to give some guidance. We know that private parties, especially large family gatherings, for example, or community gatherings at somebody's house, and people are using that 50 that we've been talking about as a benchmark. Well, that may be way too many if you are in a small house or if you're in an apartment. And I need people now to start thinking again about how do I keep myself, my family, my close contacts safe. And that means pulling back, knowing that we can't have those large groups and that we shouldn't be having large groups in our home if it's a small place. And that may mean that 2 is too many. It may mean that 6 is too many. So those are the things we need to think about again. And I use the guidance of what we've said that has been relatively effective in helping us reduce transmission in the short-term rentals and boats and resorts. And that was having an extra 5 guests. We put that restriction on to give people some clear guidance. So look to that. We are looking at restaurants and bars of tables of 6. And we've asked people to respect that because that's a number that is manageable. It has space between people. It protects the staff who are working there as well as the people who are coming in. Those are some guidance that we can look at. And we need to be even less than that if we have people in our family who might be more vulnerable, whether it's they're going through medical treatments or whether they're elderly. And if our children are going back to school or we're going back into the workplace, we need to have our distances and our measures in place in those settings, but we need to recognize that that does increase the risk. So we may need to stop other things that we would want to do, like after-school curricular, after-school activities, or going out and playing on a sports team on the weekend. So those are all personal sacrifices that we are going to have to make individually this coming fall.
Before we get to Tanya's follow-up, I just want to remind everybody that Dr. Henry and Minister Dix will release a joint statement this afternoon with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca for medical guidance on protecting families and communities, and for access to provincial guidance on COVID-19, visit bccdc.ca, and for information about the province's pandemic supports, visit gov.bc.ca/COVID-19. Tanya, do you have a follow-up?
Yes, please. Thank you. And if we could get an answer in French from Minister Dix as well, that would be great. Dr. Henry, going back to your answer just now, I mean, your overall message, how does that jive with the return to school? And, you know, doesn't that, the reasoning behind it almost fly in the face of, you know, keep your contacts in your circle smaller, yet many people's bubbles are going to grow with going back to school. And specifically, you touched on it with organized sports. You know, we just saw those guidelines come out, and we'll see a return to that.
So there's two different types of settings. So when we're talking about our close contacts, our family bubbles, those are those are hugging our kids, being close to our grandparents, our parents, our siblings, the people who live in our households. That's a very different concept than the controlled settings that we have in workplaces. And we've seen that, you know, we've had workplaces open the entire time, and they have put in COVID safety plans, whether it's construction industry and different ways of doing things to minimize the connections, the close contacts that you have to have with other people in building a building, or whether it's working in a grocery store and the measures that have been put in place there. Schools are the same. Workplaces that are going back, they all have those plans. So it's not the same as having those close personal contacts that you have within your family and your household. And those are the ones that we now need to rethink as we're going back into, more people are going back into their workplaces. They need to start thinking about reducing those social contacts where we're having those close, touching, hugging contacts with people in our environment, to the ones that are the most the ones that we need to have in that social environment. And it is a trade-off. It's a trade-off because it is so important for us to ensure that our work, our essential services continue to be done, that our healthcare continues, that our children are in school and learning and in a learning environment that's safe. So it is a trade-off, and it's a different type of environment. So we need to have both, and we need to do them both in a controlled way.
Oui, je pense que c'est absolument nécessaire pour qu'on puisse arriver à nos bouts pendant cette période de pandémie, que ce soit dans le domaine de la santé ou dans le domaine de l'éducation, que des gens prennent des mesures chez eux qui nous aident à nos buts collectifs, n'est-ce pas? Donc, c'est la responsabilité de tout le monde, chez eux, d'assurer et de se protéger contre la transmission de COVID-19. Et cela ouvre la société, ouvre l'opportunité, ouvre aux étudiants, souvent, qui n'ont pas été à l'école dans des milliers de cas depuis le 20 mars, de retourner à l'école. Donc, ces choses sont absolument liées. On veut avoir des chirurgies. On a fait plus de chirurgies pendant ce mois qu'on a fait l'année dernière. Mais c'était à cause de tout le monde, ce que tout le monde a fait dans la communauté. Donc, ces questions sont étroitement liées et il faut que des gens agissent pour protéger des personnes qu'on aime, bien entendu, mais aussi pour qu'on puisse arriver à nos bouts comme société. Et un des bouts fondamentaux de la société, c'est l'éducation pour les jeunes.
That's all the time we have for today. Thank you, everybody.